Good morning, everybody. I am Dr. Kanhu Charan Patro, neuroradiation oncologist. Today, I am going to tell about main blood supply of brain. I am not going to the titbit, but I am going to tell about the part what a radiation oncologist should know and understand. The two parts are mainly important for the blood supply. One is the vertebral component, one is the internal artery component. These combine together from the blood supply, arterial supply of the brain. If the branches, if you want to see the internal carotid artery, posterior communicating artery, anterior choroidal artery, anterior cerebral artery, anterior communicating artery, middle cerebral artery, vertebral artery, posterior inferior cerebellar artery, persistent hypoglossal artery, basilar artery, anterior inferior cerebellar artery, superior cerebellar artery, posterior cerebellar artery, and veins. So if you see, as I told, there are two components, posterior and when in this image you can see the angio picture. You can see the posterior thin and short is the vertebral arteries. They are branches from the subclavian artery. The thicker, longer and anterior is the two internal carotid arteries, left right. The right one is arising from the brachiocephalic artery, left one is directly arising from the aorta, arch of aorta. So they combine together from the circula puellis. The goal detail, as I told, the right internal carotid artery arises from the right brachiocephalic artery, and left internal carotid arises from the arch of aorta. So posterior ones, you can see two vertebral arteries just arising from the subclavian arteries. So these four is the main branch. Two vertebral arteries, two internal carotid arteries combined together at the center. They form the circle of Willis. So very clear here. You can see arch of aorta. Left one is the directly internal carotid artery. Right subclavian artery, internal carotid arises from the right subclavian, right brachiocephalic artery. Two vertebral arteries. Two vertebral arteries arising from the left one, right arising from the subclavian artery. They form the basilar artery. Then they form a part of the circle of Willis. So the internal carotid artery and two internal carotid artery and basilar artery, they form the circle of Willis. If you see the vertebral component, two vertebral arteries, they combine basilar artery. They continue as a posterior cerebral artery. Posterior cerebral artery. Then it is from the posterior communicating with internal carotid artery. The internal carotid is going laterally is a middle cerebral artery, and anteriorly is the anterior cerebral artery, and it is a small communication with anterior cerebral arteries is called as a anterior communicating artery, and this is the optic chiasm and circle of Willis. So if you go to the smaller branches to anterior spinal artery, vertebral artery, posterior inferior cerebral artery from the vertebral artery, then basilar artery, anterior inferior cerebellar artery. These are the pontine arteries. This main is the basilar artery, superior cerebellar artery, posterior cerebral artery, posterior communicating artery. This is the internal carotid artery. This is the middle cerebral artery, anterior cerebral artery. This is ophthalmic artery, anterior choroidal artery, and this is the internal carotid artery and posterior communicating artery. You can see here all small branches also. So you can see, if you can superimpose with the brain, you can see here, this is the internal carotid, the posterior communicating, this is anterior cerebral artery, this is the anterior communicating, this is the posterior communicating, this is a basilar artery, vertebral artery, pontine arteries. So if you combine superimpose brain, cranial nerves and vessels, you can see internal carotid artery, basilar artery, two vertebral arteries. This is optic chiasm. You can see here anterior communicating artery, anterior cerebral artery, posterior communicating artery. This so superior cerebral posterior cerebral arteries. How you can see here. Now these are the small branches supplying caudate, basal ganglia, and thalamus, medial lenticular straight arteries. Here caudate nucleus, the basal ganglia, lateral lenticular straight arteries, anterior choroidal artery, part of thalamus and the ganglia, and thalamus is penetrating branches of posterior artery. And if you go the main things, if you go to the upper part, anterior cerebral artery anteriorly, middle cerebral artery laterally, posterior cerebral is the posteriorly. If we go again down, then arteriocerebral artery, middle cerebral perforating arteries, middle cerebral artery, posterior cerebral artery. This is the mostly the cerebellum posterior emphasized by the vertebrovascular components, and temporal lobe is part of middle cerebral artery and posterior cerebral artery, and this is the frontal which is partly by middle cerebral artery and anterior cerebral artery. So these are the all cerebral arterial supplies. Dural sinus you can remember by transverse sinuses, occipital sinus, suprasagittal sinus, and straight sinus. Let's see where it is located actually. It is in the dura. This is called dural sinus. This is the inner periosteal layer of dural sinus. This is the durameter and meningeal layer of the durameter in between those sagittal sinus, suprasagittal sinus. Here you can see here. So superior sagittal sinus, inferior sagittal sinus, straight sinus, vein of Galen. This is the transverse sinus, sigmoid sinus, and jugular vein. You can see here. This is the sigmoid sinus. Two sigmoid sinus around laterally. Sigmoid sinus. These are the right sigmoid sinus. This is the transverse sinus. This is the transverse sinus, left and right. So this is the vein of Galen. This is the straight sinus, superior sagittal sinus. You can see here. This is the straight sinus, vein of Galen, and superior sagittal sinus. So this is the superior sagittal sinus, straight sinus. This is the transverse sinus. These are three sinuses you can see here. So this is the confluence of all sinuses here. Straight, superior, sagittal, in transverse sinuses. This is the sigmoid sinus. This is the transverse sinus. This is the straight sinus. The then vein of Galen you can see here. So I'm going to tell about some directly from the so you can see here. It is a, if you see, you can see this is the internal carotid artery here. You can see the internal carotid. It is going to the carotid canal, then lacerum. You can see the from the transverse sigmoid sinus, cavernous sinus here. This is the cavernous sinus. You can see here. This is the circle of Willis area. But if you, this is the internal component, you can again you see once. So this is the focus on this. This is the internal carotid artery going carotid canal, then foramen lacerum, and going. This is the cavernous sinus, two lateral hyper dense areas, cavernous sinus. Then this is how it is from the middle cerebral artery and anterior cerebral arteries, how it is forms. Then I will go for the vertebral artery component. So see two vertebral arteries in the lateral, in the condyle of the condyle of the condyle. You can see two vertebral arteries. They go together. They combine from the basilar artery here. They combine the basilar artery here, and it goes up. You can see here basilar artery. They continue the superior posterior. They continue as a posterior cerebral artery. Before that, they superior cerebral artery. The before that, then posterior cerebral artery. Then they form the posterior communicating artery, and again this. This is the these are this is the sigmoid sinus. This is the straight sinus. This is the transfer. This is the transverse sinus, and so these are the so these are the you can see here the superior sagittal sinus. This is the straight sinus. This is the straight sinus. The confluence of sinuses. You can see the in the cornal view also. two vertebral arteries here how they combine together, basilar artery. You can see the things easily. So exercise yourself, take some CT scans, MRI, ask for the angiograms, ask for the venograms, ask for the time of flight imaging, and you can understand easily about the blood supply and venous drainage of the brain. Thank you very much. So um, uh, uh, thank you very much for watching, and you can like, comment, share and subscribe my channel. Thanks for watching.